Should I get a hair transplant? Should I get a hair transplant? Well, I can tell you that a couple of summers ago, my daughter started taking pictures of the top of my head, and she was photographing my hair loss. I got to say that it really bothered me. And I immediately, once I recognized I was losing my hair, I immediately started doing something about it. Now, I've responded adequately enough to where I didn't need to pursue a surgical option, but if it continues, if it picks up, if it gets worse, I will be getting a hair transplant. Now, who is a hair transplant for? Well, it's for individuals who, when they look in the mirror, they don't like what they see. They don't like going around without a hat on. They avoid certain social environments like weddings and graduations and funerals because they can't wear a hat. There are individuals who change jobs because they can't wear a hat at the job they have, even though they may not make as much money. It's ideal for individuals who, are insecure about their appearance. And you'd be surprised what improving your personal sense of well-being will do to your confidence. And it improves your ability to work and interact with others. Oftentimes helps you get involved in relationships, get married, and have families. Hair does not make you successful. It does not make you be a good father or be a good spouse or successful in your business. It just makes you feel better. So if your hair loss is bothering you, you should do something about it. Once your skin becomes bare, we really don't have much option other than a hair restoration procedure. Now, today we are fortunate. We have pharmaceuticals, we have biologics, we have good quality PRP, we have adipose-derived mesenchymal stem cells. We have new treatments coming down the pipeline, including exosomes. But all these things are not for everyone. Some individuals like it natural, and natural means using your own cells, not pharmaceuticals, or using your hair follicles. Now, the issue is that there are a limited number of follicles in the donor area, and hair loss tends to be progressive. So, we always weigh on one hand how many follicles you have in your donor area, and on the other hand, how much hair loss you currently have and how much hair loss you are anticipated to have before we decide whether or not you are a candidate for hair restoration. Some individuals have coarse hair, they're better candidates. Some individuals have fine hair, and they're not as good a candidate. You may have more follicles in your donor area than the average individual. This makes you a better candidate for hair restoration surgery. What about age? The younger you start to lose your hair, the worse candidate you are. And the more aggressive you need to be in terms of trying to minimize your progression of your hair loss. And this is because individuals who start at an early age typically are going to lose a lot more hair than individuals who start later in life. So, when do you have to transplant hair? Well, when your skin becomes bald, you have no option. You have to transplant hair. As long as you have hair, native hair, in your top of your head, you want to try to maintain that and thicken it. You want to increase the density of that. You want to increase the diameter of that. And we can do that with the products we have available, including pharmaceuticals and biologics. But once the skin becomes bald, the only option is hair restoration surgery. So hair restoration surgery is not the last option. Sometimes it is the only option for individuals who hair loss bothers them. So the bottom line is, if your hair loss does not bother you, and you look in the mirror and you're losing your hair and you're totally comfortable with who you are, you don't need a hair transplant. You may not even need to do anything about it. But if you're like me and you started looking at pictures of yourself, or you saw yourself in the mirror and you didn't like what you saw, you need to be proactive, try to get your hair back through regenerative techniques, and if you have to, through hair restoration surgery. Because you're going to feel better, and you're going to be more confident, and it's going to improve your overall personal well-being and the way you interact with others, and it'll help make you a more successful person because you'll have that confidence to succeed in life. And I see it all the time with very, very successful individuals, billionaires, millionaires, owners of publicly traded companies, startups that are headed to be very successful. All these individuals, you would assume, would be completely confident with who they are when they look in the mirror. But even these very successful people are concerned about their hair loss. Everyone wants to look their best. And hair is a huge part of that.
Forehair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the Forehair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forehair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forehair's video uploads. For online consultation, click on the link on the screen or in the video description.